Leader Rounding is about fulfilling the mission. It's about extending the healing ministry of Jesus Christ. It's about us participating in and ensuring that our physical, mental, emotional, and spiritual needs of our patients are being met in our organization. So when we round, we ask our patients questions. We ask them if it was quiet enough so that they could sleep. Sleep's important to their physical well-being. We also ask if the nursing staff has been in and made rounds frequently. And when they came in, did they ask if you had any pain, if there was anything they could do for you, if they could get you up to the restroom? Again, all of these things help with the healing process. We check on the communication with the physicians. We check on the communications with our nursing staff. Again, education for our patients to help them understand what's going on with them is very important to their healing. And I would say probably 80 to 90% of the time when we're rounding, we follow a general routine or a pattern. But there's always those one or two cases that stand out with our patients in which they need a little bit more from us. They need more of the emotional and more of the spiritual healing. Let me give you an example. Sometimes when we go in, the patients may tell you that they have concerns about how they're going to pay their bills. And so we may offer to help with some of our staff from the Financial Help Assistance Program. The patient may have just learned that they have a terminal illness, so maybe they need some emotional support. Rounding and the patient experience is not about making people happy or getting high scores on your HCAHPS. It's about creating a culture where the staff exemplify and the patients feel the breadth and depth of our ministry, of the healing ministry of Jesus Christ. If we do this, the scores will come.
We started this journey in 2008 when we were studierized, but we were not seeing the results in press gaining. And so we had to hold ourselves accountable to those results. We thought we were patient-centered as an organization, but our results kept telling us something different.
We've been struggling with it for a year. We're a very tight group. I either picked them, or in building Fort Tower, they picked me, and coming to the floor, and they wanted to keep their nurse manager and realized they needed to own this experience and make this happen.
So we started by having an accountability meeting. We had to come and share where we were in the results and what we were doing to improve those results on a weekly basis. We then had action plans for each unit. What are you going to do to reach that? We worked with individual employees that we identified as low performers. Some people were having a hard time embracing that we were going to do this, and we had to change. We had to implement tactics that were different.
The two big words that it took Pat a year to beat into my head was meeting expectations, meeting the patient's expectations. It wasn't acceptable for me to say, but Pat, they waited 6 hours for their bed because we're holding in the ER, or they weren't happy because they didn't enjoy the bedside manner of the physician. Those were not acceptable excuses. It took a year for me to get meeting expectations.
It's more than physical. There's the emotional and the mental parts of it that oftentimes get overlooked. And, you know, getting people something little as an extra blanket to keep warm with can do wonders for making them better.
And it helps tremendously having more people involved, such as our secretaries and our PCAs, our managers, our charge nurses. There's just so many people now there for the patients besides just the nurses. And I feel that now there's new generations of nurses coming in constantly. So it is about now teaching all these nurses coming in how we do things now.
We are talking about a major culture change in how we delivered care, and in many ways, people were delivering care this way for 20 and 30 years. It really was different. I mean, we were in charge of the patient. Now we're saying the patient's in charge of this experience.